Hi, my name's Matthew Pollock, chiropractor and applied kinesiologist for Savoy Health. Well, today we're going to talk about cholesterol Q&As. Now, lots of people these days seem to have a cholesterol problem. Cholesterol problems are very interesting, and many doctors would have you believe that cholesterol is a real big problem in society, which it tends to be at the moment, but cholesterol is actually something that's beneficial to our body. We wouldn't have complete health if we didn't have cholesterol, and in fact cholesterol isn't the demon that we make it out to be. When patients come in and we test them for their cholesterol, we're predominantly looking at what elements of cholesterol are the difficulty for them. If they show up as having not enough of the good or high density lipoproteins, which is the good fraction of cholesterol, there are nutritive means which we can increase that or help the body to assist in increasing those levels of HDL cholesterols. And conversely, we can lower the LDL or the low density lipoprotein fraction, which is the bad cholesterol, if we need to. Now, in the short term, again, because my ideal solution to this is to modify and change the diet so that it's appropriate and the person can heal. But in the short term, we do have a number of natural methods for doing this, which are herbal and supplements that we can use quite effectively and statistically are shown to be equally as effective as the statin drugs. However, they do not have the side effects of the statin drugs, which are quite horrific. If you're on any medications, you should always read the side effects in the little brochure and decide if they're the complete answer to what you want, and are there any alternative and natural means where you can get the same results. And we would suggest that you follow those. Cholesterol, 2/3 of the body's cholesterol is produced in the liver, which means we don't really need a dietary source of cholesterol. So most of the time, the answer to assisting someone with their cholesterol is to rule out any dietary sources of cholesterol, which the only dietary sources of cholesterol for man are animal-based products, including meats, whether that be fish or chicken also, or the white meats, and also dairy products too. When you reduce these dietary sources of cholesterol, we tend to do a lot better from a cholesterol standpoint. Now, the other thing that impacts is our stress levels. Now, the way that our stress levels drive our cholesterol is our stress hormones and our sex hormones all start from the fundamental building block of cholesterol, which is why we produce it in the liver. So I want to have a look at your stress and your adrenal pathways, and if we find that they're regulated very, very high, that could be driving your liver to produce cholesterol. So that's one of the reasons why we want to take care of any stress in your situation and also assist the body to down-regulate that pathway. If we can down-regulate that pathway very often, your body will self-regulate its cholesterol and we won't need to look at it. There are many ways of looking at cholesterol, many natural ways that aren't harmful for you, and we can certainly advise you of those. It would be my absolute pleasure to do so. So why don't you drop into Savoy Health and say hello, and we'll do our very best to give you some assistance. Thanks for taking the time to listen. Bye-bye.